All right, we are recording. And then if no one else has any technology, I see you with yes.
Thank you. I was just going to say, for whatever reason, my Zoom screen doesn't have a translate button at the bottom. I have reactions, record, share screen, chat, participants, but it doesn't have, I'm okay. I'm doing pretty good in English though, so I probably will be okay.
Yeah. If someone needs interpretation, you can also message me. That might be something I as the host have to control.
Okay.
All right, great. But we wanted to make sure this is open to everybody. So hello everyone and welcome. I'm gonna go ahead and turn this over to Dan as it is 12 o'clock. We are being recorded. I'm your tech specialist for today. So if you have any questions, please message me. Please mute yourselves and please remain on the chat for most questions. Raise your hand if you can't type it out. Thank you. All yours, Dan.
Okay. Thanks, Brianna. So I'm officially welcoming you to our July meeting of the Coalition for Affordable Housing and Transit. There is an agenda that all of you should have gotten when you got the notice of the link, and we're going to follow this agenda. We really try to stay within an hour for each of our meetings, and the program will be facilitated by Becky Winders when we get to that. Before we start, I'd like to ask for a moment of silence. You know, we lost a great champion for justice and equality in the passing of Representative John Lewis. He was a man of exceptional character, courage, and humility. We're all better for his life and impact. It's also a day that Reverend William Barber has asked us at noon to take a minute of silence in recognizing the Poor People's Campaign and also Black Lives Matter. So if you will join me, please, in a moment of silence. Thank you. The next item on our agenda is a spotlight, which we do every month to recognize a program to try to have all the members of the coalition understand what member organizations do within the community. And today we have with us today a discussion about the transit equity plan from Bike Durham. And Mark, are you on?
Yes, can you hear me?
Yes, if you'll introduce yourself and take a minute or so, and then we'll hear from Marie Hill-Faison about access the paratransit program.
Sure, okay, so yeah, my name is Mark Maximov, and I'm a board member of Bike Durham. I'm the chair of the advocacy committee there. And our executive director, John Talmadge, would have been in the meeting today, but he's on vacation. He's in a national park in Tennessee with no internet access. So yeah, so Bike Durham was founded in 2013, and bicycling was our focus from that beginning, but we've lately really been expanding our focus to include pedestrianism and transit in our advocacy work. And especially in the last couple months, we have been expanding our sphere of advocacy to include things like housing. Especially for the past year, we've been concentrating on things like that. Things that there are inequities in transportation investment that reinforce other elements of structural racism. And these are some of the things that we're trying to work with other organizations on. So we did launch 2 campaigns in the last month. One is a transit equity campaign. And our director, John, worked for Go Triangle for, I think, 21 years. And he says that the approach at places like Go Triangle, the sort of one of the missions was to expand the ridership of the bus networks. And the idea was that if you got, you know, more middle class, such people riding the buses, this would increase the kind of the juice it had in the city and would increase the funding. But we are now looking at, Bike Durham is trying to help a reorientation to addressing the people who actually use the buses. And I want to hear directly from the people who are the customers. And we want to engage directly with them rather than just hoping for another segment of ridership. We're also engaging in a Safe and Healthy Streets campaign, and that has already begun here in Durham. We actually are partnering with the city, and the city's taking the lead on that. And the idea now, oh, am I frozen? Uh-oh.
We can hear you though.
Uh-oh.
Mark, can you hear us? Well, why don't we move to Marie Hill Faison and then come back to you if you're able to get you unfrozen. Marie, are you online?
I am.
Well, let me just say there's not a bigger advocate for paratransit than you, Marie, and so I'm glad you're with us to talk about it and to talk about those, not just the folks who use it, but the providers too. So it's all yours now.
Well, thank you. My name is Marie Hill Faison, and I am a paratransit operator for Go Durham Access. And during my 18 years there, I've been able to see the different changes and experience the problems that transportation has here in our area, and have always tried to give a voice to the issues, but unsuccessfully to no avail. I wasn't able to do anything to help the situation, which is one of the reasons why I'm participating now, is so that I can bring awareness to this service that is being offered, which attracts a lot of people to Durham. The paratransit system, it is a system that came about through disabilities, and basically operator transport clients to doctor's appointments, to employment, and to in some cases, life-threatening treatment. So it's very important that we have been deemed essential workers. So I've been trying to bring the history into this, and we should always look to where the service come from so that we'll know where we're going ahead. And predominantly right now, all the clientele is mostly people on fixed incomes, people of color, and people that have no other means of transportation, and possibly with disabilities, medical disabilities, mental disabilities. And I would like to bring awareness to the service and be included in conversations to improve the service. So I don't know how much time I have, but that's pretty much what I wanted to say as far as an introduction to exposing our community to the service that we provide.
Right. Thanks, Marie. That's exactly what we need to hear. And I just once again appreciate your leadership on this and your advocacy, because you have really, I know you've opened my eyes to the need to strengthen our paratransit program and those providers who are at risk as essential workers. So thank you for that. Now, Mark, are you back online? I guess not. And so we'll move on. And so let me turn it over to Becky Winders, who is going to moderate our program today. Becky, I know you're on, so you can take it over.
And I can't see myself, actually. I may be muted.
No, we see you, we hear it. And see you, yes.
Okay. I'd feel more comfortable if I could see myself, but I can't. But anyway, there are too many people here, I guess. I can't find. So we're very pleased to sort of branch off in a new direction with this program. That the coalition has been focused on the city's affordable housing plan and bond issue for at least a couple of years. And we have been looking at the opportunities that will be created by and are being created by those programs. But today we're going to look at it look at a different aspect, looking at the opportunity that the affordable housing expenditures can give to for jobs and business contracts for businesses. So we have a very distinguished panel today. We're going to start off with Reginald Johnson, who is the director of the Department of Community Development at the City of Durham, as many, if not all of us, know. And he's a very important person in affordable housing in the city. As he administers all the HUD programs and or he oversees them, and the city's dedicated housing fund. And he has a very long and impressive bio. I really have to hit the high spots on it. And I would say that he is from Louisiana, and he graduated magna cum laude from I think that's a high spot. He came from Southern University and AMM in college in Baton Rouge, and then he has a Master of Public Policy from Duke and a Juris Doctor from UNC. So he is both a Blue Devil and a Tar Heel, or Ram as it may become, and he has worked at a few policy positions before joining the City of Durham, first as a assistant city manager, and then took over the community development department. He doesn't provide any dates in his bio, so but I remember it's at least 10 years ago. And then another high spot is that he sings in the choir at St. Joseph's. Then next on our program, I believe, it will be Adria Graham Scott, who is also a city representing the City of Durham as the Senior Workforce Development Manager for the city's Office of Economic and Workforce Development. And she also serves as the Deputy Director for the Workforce Development Board, which I hope she'll tell us more about, because I've known of its existence, but but she might not have time today. She has been here for about a year and a half, and previously worked in community and economic development in Baltimore, Richmond, Los Angeles, and Nigeria. She holds a Juris Doctor from UCLA and a BA in economics from the George Washington University. And third, and I've seen her on here, I have not seen Melvin Green. I hope you're here, Melvin. And we welcome you also. Melvin is representing the Durham Housing Authority, where he serves as a resident services program manager, and currently co-interim director of resident services. The resident services department or office of DHA provides self-sufficiency, educational, and healthcare related programs and services that help DHA residents move in and move up. Melvin is from Warrenton, and he has, before he came to DHA, which was not quite 10 years ago, he worked for in several human services positions in Warren County, some nonprofits and the Murdoch Center, and he's also been a dental assistant. So we welcome these panelists to our program, and I think Reginald is I'm going to turn it over to Reginald. I think he's going to they have all organized their presentation, And I don't know whether do you all have anything that you want to share on screen?
No, I do not.
Okay. Okay, so we have 25 to 30 minutes for the presentation and then 10 or 15 minutes for questions. And people, we encourage attendees to put questions in the chat. And I hope that some people, Wib and Marcia, Diane, some people will help catch those questions as they're going by, and we'll all feed the questions back to you when we get to the question and answer part. And I'm going to sort of try to keep track of time, and I apologize in advance if my phone alarm goes off or something. So I'm just set it on 8 minutes a person, but really you can stretch that a little bit. So let me turn it over to Reginald.
All right. Well, thank you, Dr. Wanders. I would add that Melvin and Adria do have presentations. They just put that in the chat. I just saw it. So just so you all know that. Good afternoon to everyone. It's glad to be here, and thank you for your gracious invitation. I'm Reginald Johnson, and I have the pleasure of serving as Director of the Department of Community Development for the City of Durham. And my task this afternoon, this early afternoon, is to talk with you a little bit about the bond referendum and minority and women-owned business contracting opportunities. And so I'll do that. I won't be long. Definitely want to hear from the other presenters, but I'll sort of do a little bit of framing. And just to reground us and what has happened, as you know, the voters in Durham, with the help of the leadership of the city, City Council have approved a $95 million affordable housing bond referendum. And that was matched with about $65 million in federal and local dollars that we already have for a $160 million package over 5 years to create affordable housing opportunities. And as we were discussing this last fall, when about the community, there was interest not just in creating affordable housing opportunities, but to see and ascertain whether what were the possibilities of using these resources as a way to strengthen and create minority and women-owned business opportunities, as well as job opportunities in our community. And so we heard that, and that was, as many of you know, because many of you that I see here were part of that discussion. And so what we're gonna do here is just talk about where we're going and what has been done thus far. And so if you recall, it's not just about building units and preserving units, but one of the main things is that the Housing Authority and the city both have committed to increasing the opportunities for minority and women-owned business. And I'll kind of refer to them as MWBEs. And the city and Durham, city and the DHA are partnering to train DHA residents in construction jobs and connect those residents to job opportunities. That's one of the goals with the passage of the bond referendum. And just to give a little detail on that, with the passage of the bond referendum, that's not bond funded, but because of the passage of the bond referendum, we were able to use our non-bond dollars to create a program. And so that program is in its infancy stages in terms of its creation right now. And so Mr. Graham Scott and Mr. Green will talk a little bit more about that. But I just wanted to share with you what the goals are. In terms of the city has committed to establishing targets for all city-funded housing projects of 11% minority and 7% women-owned businesses. That's based upon the total dollar value of the contracting opportunities. And these percentages are consistent with the targets established by the city's Equal Business Opportunity Program. Community Development Department in particular has just released its first bond housing development request for proposals, which was a $15 million RFP to provide gap funding for multifamily rental projects. The RFP did contain MWE targets, which were written into the which will be written into the contracts with the developers. And failure to adhere to these targets will impact the developers' ability to get future funding. In light of the growing volume of housing projects, the department has recognized that we need additional capacity to provide the training and technical assistance to developers to help them meet the contracting targets and maximize local hiring, and to be on track as well as the reporting. And so what we've done, we're preparing a RFP, request for proposals, to bring on board some consultant to help us with the technical assistance, the outreach, and the monitoring as we go along. We do expect to be reporting our progress to the Affordable Housing Implementation Committee, which was established by the City Council. They're in the process of establishing that now. And then we're also working on and issued a RFP for a marketing firm to help us, communication firm to help us share with the public, better share with the public, all of the work that's going on with the bond referendum, including these targets that we're speaking specifically of. And so actually I can say that you're probably the first to hear that the awardees of that will be a woman-owned business, as we just completed that. One of the questions, it just closed and we did the selection process. One of the things that Dr. Wanders did share with me, there were some questions that folks wanted to know in terms of what have we done this year in terms of RFPs. It takes quite a bit of time to prepare the RFPs in relation to what we were doing, but we've issued 9 RFPs since January of this year, including the one that I just shared with you, which was the $15 million one, which just closed, just recently closed. And then the other one I just told you, shared with you, was about the marketing and communications firm. But the rest of the RFPs are actually still open. That's 4 of them are still open in terms of, when I say open, they're still accepting applicants right now. So that's 4 of them. And then 3 of them are related to homelessness, and those only nonprofits can apply. So those are not owned businesses. Those are nonprofits that are not, don't anticipate having subcontracting opportunities because they are providing services. And so I know that I tried to get at some of the information. The total value of the ones that we have awarded, and I think that was one of the questions, was about just over $776,000 thus far this year. But like I said, the $15 million one that we issued is still, they're just closed. And so we have not evaluated the applicants for that RFP. So I just want to give that background and context to particularly to the presentations that you are going to receive. And I hope I didn't go over my time.
Thank you very much. So who's up next? Melvin? Adria?
Good afternoon, everyone. I'm Melvin with Durham Housing Authority. I'm not sure if Adria is. Can you hear me?
I can hear you.
Okay. Are you able to see my screen?
Yes.
Is the presentation up?
Yes.
Okay.
Yes, it is, Melvin. I'm on now, unmuted.
Okay. Did you want to open Adria or?
No, you can go ahead and get started. If you can put it into the slide show mode, and that would help everyone to follow along.
Okay, there we go.
All right, I think you kick it off with the discussion on the project.
This slide is DHA's development plan, and it covers new construction and rehabilitation for over 2,400 units. And these units will be newly constructed or rehabilitated over the next 10+ years. And the estimated budget is over $500 million, and it will cover 7 properties. These include J.J. Henderson, 519 East Main Street and Liberty Street, the DHA main office downtown on East Main Street, Forest Hill Heights, Fayette Place, and with the city properties, Rigsby, Hunt Street Station, and Southside 3. And this slide here shows a conceptual artist's view of what these sites may look like in the future. Of course, these are just drawings and nothing is concrete just yet. If you look at the development and timeline budget, J.J. Henderson is slated to begin this year with a completion date of 2021. 519 East Main Liberty Street hopes to begin next year, this year. Well, J.J. was supposed to begin last year, but will actually begin this year. 519 East Main and Liberty this year with DHA office. Next year, followed by Forest Hill Heights and Fayette Place, and finishing up with Rigsby and Southside 3. And these projects total 2,451 units, and the 3 sites that are listed are covered by the housing bond funding. And that's 519 East Main, which is formerly Oldham Towers, along with Liberty Street, the DHA office, and Forest Hill Heights. And next is the challenge.
So I think a number of you have already seen at least portions of this presentation in the past. And I felt that it was important to still provide you again as a restatement of what it is that as a total, as a partnership between the city and DHA that we're trying to accomplish and whom we're trying to accomplish it with. I think one of the key things to never lose sight of, and certainly with the COVID crisis, it's led us to understand that this is a much more integrated type of environment than we had previously thought about. I've always spoken about the continuity between economic, community, and workforce development. But now we're looking at it in much more of a structural interconnectivity. There's not necessarily linear, and there are many different factors that weave into that. And of course, you know, with the COVID crisis, it has accentuated the fact that health is a critical element. That, of course, with affordable housing and the way it weaves in where you live, how you're working, where you're working, where you're attending school, all of these things start to play into your overall success. And affordable housing is one of those many key indicators that play into it, as does transportation. Just as a quick review, and these statistics are from 2018, 2019, but when you look at these quick facts from the census, you'll see that the city of Durham has roughly 275,000 people, the median income 54,000. You know, it's one of the highest median income areas in the entire state. 49% have college degrees. It's easy to recall that we have, you know, RTP and some of the largest and major corporations in the world based right here in this area. We're the home of Duke, NCCU, Durham Tech, and in close proximity to many other highly acclaimed higher institutions. But on the other side of the coin, we have a 17% poverty rate. 1/5 of those who are in poverty live in public housing. And just using raw numbers, this is not using the unemployment rate, the formula for the formal unemployment rate, which actually ends up excluding many individuals. This is just looking at the raw tally of the number of work-able adults who are not employed. And when you look at it from that perspective, you're looking at 60% unemployment rate. And that distinguishes between the unemployment rate, which incorporates all of those many different indicators and ratios. This is just raw numbers. The average income of a DHA resident is about $13,000. And you see that the average rate paid is about $238 per month. All of these things are speaking to, I want you to think in terms of a profile. These are averages. We're looking at the general profile of the community that we're trying to serve. Next slide, Melvin. Next slide, thank you. Overall, you know, as we look at how do we move the strategy forward, when you see what DHA in terms of their overall resident population, it's 4,800 households. They're the largest provider of affordable housing in Durham. Now, of course, as we're moving forward and looking at affordability, it's a little different dynamic and a different discussion than affordable housing. Affordability and affordable housing are different discussions. But we're talking about roughly 10,000 Durhamites. And in that group, there are individuals that are living in vouchers, that are using vouchers. So they're in housing throughout, and there are individuals who are living in large communities like McDougal Terrace. Again, just trying to help to see a profile of DHA residents. And I want to be clear, the reason that I'm focusing on the DHA residents is because our particular pilot is very specifically and intentionally targeting DHA residents. That's part of the broader and bigger strategy. And I want to take a quick moment and speak to that. Prior to when we had our COVID crisis, when it exploded onto the economy, if you remember, we were at very low, close to almost full employment. What that meant, as just referring back to what I said earlier, the unemployment rate is full of all of these various indicators and ratios. But one thing that is outstanding is that when you're not looking for a job for a particular period of time, you fall out of that ratio. And what has happened prior to the pre-COVID world, we had a low unemployment rate. However, there was a significant number of individuals who have completely fallen out of the workforce. They weren't looking for jobs. They have been out of the workforce for a number of years. And in addition to that, they face a series of barriers that helped making employability a very difficult task. What my organization does as the Durham Workforce Development Board is we administer a federal program called the WIOA, it's the Workforce Initiative and Opportunity Act. And what we do is we take individuals with barriers and provide them with training and other opportunities. We can provide upskills, we can provide credentials, anything to help move them along that continuum so that now they can not only become employed, but that they can sustain employment and actually move forward in terms of building self-sustainability. It's not just about checking a box off that you have a job. It's about trying to help people to move that ball down the court, to help them make that change so that now they can become self-sustaining and move themselves forward. So again, you've seen a couple of different slides go by that show who lives in the community, but this one in particular is a very telling thing. The slides previously showed who was in the community. This slide is showing to you what our future looks like. Okay, Melvin, are you moving the slides? Stop.
Yes, I wasn't sure where it needed to be at, and I apologize.
Okay, this is fine. What this slide is a snapshot to show you, to demonstrate what our future is like. The schools that are represented on this slide are all feeder schools into the Durham public housing community. And I wanted to put a series of timelines there so that you can compare. Because when you look at elementary schools in 2017 and you look at their performance, then that immediately starts to dictate to you what the performance of the next cohort will be when they enter into middle school, and so on as such into high school. And it's important for us not to let go of the fact that we have a very dynamic public school system. We have dynamic leaders in the public school system, but our public school systems are challenged. And this is just a portrait to demonstrate the challenge that our public schools face. Let me say that with the advent of the COVID crisis and the digital divide that already exists, while our public schools have a strategy to help to address some of the technology deficits, there's more than just the equipment that is going to need to be addressed. We need to try to meet the needs and to build the capacity of our students so that when they exit out of high school, that they now become part of they become competitive in our workforce. When you look at the industries in our area that are hiring, they're hiring primarily on higher level skill sets. We're talking about IT, health, even our advanced manufacturing. Our advanced manufacturing is centered largely in our biopharm industry. So when you look at hospitality, entrepreneurship, and some of the other categories, even in retail and in restaurant ownership, those are areas that our students or our graduates would have had an opportunity to enter. But consider now, with the advent of COVID, there are so many unemployed individuals in all of these areas. They are now competing for those spots that would formerly be available to some of our graduates who may not be at that entry level in order to enter into the IT field or the health field. We want to make a scenario so that all of the students, as they're moving through the process from elementary to high school, that they come out of high school and can be a competitive part of the workforce going forward, that they don't need the upskilling and the additional training, that they now can just complement their learning without having to remediate. Okay, if we can move forward.
2 minutes left.
I'm sorry. So when we're looking at what we're trying to achieve with our pilot program and our partnership, we're looking at both sides of the equation. We're looking, hello? Did you have a question, Dr. Winters?
Yes, you have 2 minutes left.
Okay, thank you. We're looking at both the demand side, as which Reginald talked about, building the capacity of the MBEs, and we're also looking at the supply side, building the capacity of our workforce. So we're taking individuals, we're training them, we're providing them with hands-on experience so that when they complete their training, they will then flow directly into jobs, which we're primarily looking at into the construction industry because of the bond process and the affordable housing projects that will be going on for the next 10 to 12 years. That is a viable area for sustainable career progression. And so our goal is to utilize all of the tools we have to help build our workforce supply and to also provide extra incentive to the hiring entities using the Section 3. The Section 3 application portion will help incentivize employers to take on the participants in our pilot. And that's it. This just shows the workforce, the board priorities so that you can see that it's aligned with both the city priorities and the priorities of what we're trying to achieve in our pilot.
Yes. Options. Okay, now is everybody muted? Okay, there goes my. Okay. I'm sorry, I don't know what's going on here. Am I,
We can see and
Back
hear
to
you,
you,
so go ahead
Dan.
with questions. Yes, we can see and hear you. So if you want to go with the
You
questions
can
and
hear
answers, now
me,
we
huh?
got. Yes, yes.
Okay, so Wib, I have been looking at some questions, but at this, having difficulty, I see the first question I saw was a question for Reginald, I think. So as we talked, he mentioned the number of RFPs that had been put out this year, and there was a question of how were those RFPs advertised, and what outreach was done for those particular RFPs.
Ready for me to respond?
Yes, yes.
Oh, great. That's good question. So just to give an order of magnitude in terms of the city, what the city requires is that RFPs be put on the city's website, on the purchasing division website. As a matter of routine, the community development department actually goes further than that. We actually put it on our website. We actually send it to our listservs, depending upon the nature of the work. We actually still advertise in the newspaper, believe it or not. And so we make sure that in some, as part of the city process, we do have to make sure that we use the list that the Office of Dial Shop, I just call it Dial Shop, has, and they provide to us as well and send it out. So those are the different ways that we do advertise.
Yes. So I probably got one of those announcements in my email, but didn't read it. Is that what you're saying?
Well, we do, as a matter of routine practice, it's been our practice since I've been director, is that we do send our RFPs that are issued to our network to make sure it's one in addition to what the city requires.
Yes.
Okay. Becky?
Yes.
This is Wib. Let me just say quickly that I've asked Reginald to send me the data, the information that he listed about the RFPs and the dollar amounts and so forth. And we'll make that available to everybody on the coalition's emailing list, so we'll get that information out. And then there was a question that said, I think as the presentation started about DHA, it appears that none of the affordable housing units enable residents to become homeowners. Is that correct? And I thought we would give Melvin or Adria a chance to respond to that. None of the affordable housing units enable residents to become homeowners. So with DHA, Melvin, do you want to?
I'm not with the development department, but to my knowledge, there will be home ownership opportunities.
Okay.
As we are building mixed development communities, home ownership is a part of that plan. I can't tell you the specifics to that, but home ownership is in the forefront of what we are presenting.
Okay. DHA as an institution, though, has rental units that in the sites that you have housing. Those are rental units, I believe. But I'm glad to hear about the other as well.
Yes, if looking at the plan, we're adding probably 2 to 3 times more housing than what we currently have. So that will allow for some home ownership opportunities.
Okay. Another question was, do the averages regarding DHA residents combine public housing residents and housing choice voucher recipients, or only the public housing residents that were part of this slideshow?
Those numbers combined everyone. They combined both the voucher holders as well as the actual residents that are in the various site locations.
Okay, thank you. The next question was, what is the breakdown between individuals served versus families served, and how many of those families are headed by single parent? Oh, this person says they've seen that information, so thank you. Another question, well, that question was answered about the focus. Is it just on senior housing? And the response was, no, it's not just senior housing, it's family housing as well as senior housing in terms of the focus of the program in the building. And a question was asked about the funding from the residents of McDougall Terrace with regard to transportation and childcare, but then that was also answered a little bit further down, that the city's funding in support of DHA for McDougall Terrace is separate from what's being discussed here. That's in the dedicated housing fund. Do y'all want to have any additional comments on that? Okay.
Yeah, can I just chime in?
Please.
I saw a question while I was in the chat. Somebody asked a question, and I can't remember the person who asked, but why does it take so long? That's basically what the question was. And so I'm glad to answer that. And it's a great conversation that everyone can be adjusted in terms of their expectations. So particularly as it relates to the bond referendum and the city's portion of the bond referendum, and the $15 million RFP that we just issued. It's for gap financing. What that means is that we're using developers who want to create nonprofit, create affordable housing opportunities, whether they're nonprofit or for-profit, but they don't have all the resources. And the resources we're providing is to help them to fill gaps. That's not all the funding. That means that they have to have a project in mind. They have to have funding from other places, and it takes time to develop those. And so we're talking about, and it could be a year. That's nothing insurmountable or the extreme at all. And in the case of, and I'm just talking about before COVID even came to an existence. So one of the things that we were able to do in community development with our RFP for the gap financing, it was a little bit off track because as you can see now, I'm in my office. I'm the only one that's here. Everybody else is working from home. But we were able to, with some delay, get the RFP out. But also the same thing with the applicants that they are dealing with COVID also. But it does take a while to put projects together. You have to find the land. You have to get all your other funding sources, not just the funding sources where we're making the gap financing. And so it is complicated. It does take a while. And so I would not expect, for example, the bond referendum to pass in November and you have a building, a ribbon cutting in December of the following year. That's not.
Okay. Becky, the next question I'm seeing says it's about DHA. It says that DHA or the city, I would say, have an estimate for how many, if any, of its residents will be trained and work specifically on the redevelopment of the DHA properties over the next 5 to 10 years. That is, do you have a goal in terms of residents, DHA residents trained and working on these projects?
We haven't listed a specific goal. Our goal is to try to train as many individuals as are interested in participating in the program. We have a partnership with Durham Tech, and that Durham Tech project, for instance, right now, because of COVID, we can train only 8 people at a time because of the social distancing requirements. And the type of training that they're going to be receiving is you have to do it hands-on, right? Because it's construction-related training. So these are sort of these exterior types of factors that limit our ability to have larger and larger cohorts. But we're looking to just keep a running kind of workforce pipeline so that we have a pipeline of individuals that continually go through the process.
Okay. Thank you. Ms. Graham-Scott, I should have asked this, but can you make available to us, I'm sorry the time was so short in terms of getting your PowerPoint, but can you make the whole PowerPoint available to us send it to Dr. Wanders or myself, and then we'll get it out to everybody so they can be able to read and see the whole thing. I think that would be very helpful.
Yes, sir.
All righty.
I see one more question that hadn't been addressed. Are there any services to identify residents who already have skills, or have you done some, does DHA have some assessment of existing residents, or how will you go about doing outreach to people when the opportunities are available?
Well, currently what we do is each of our public housing communities has what is known as a resident council, and they have monthly meetings. And the Resident Services Department assists our resident councils, one, in accessing resources, and part of that process is bringing in partners, whether it's the city, the county, or other organizations that may provide opportunities for employment. That's one method that we use, is to bring people face to face. We also work with individuals who are enrolled in our self-sufficiency programs through resident services. And those residents are usually the most likely to have some skill sets that may translate to employment opportunities. But what we do is we do door-to-door flyers. We have a Facebook account. DHA has one, and then the Resident Services Department has its own, where we have a faithful following, where we put out information regarding any and everything that may be applicable to our residents. So we use a multitude of ways to reach our residents. And part of the plan with the pilot program is to have them enroll in the WIOA program, where they would be assessed, and so that we can determine what their skill set is and move them forward.
I think we're about out of time here. We need to move on with the rest of the program, and I'll turn it back over to Dan.
Becky, let me just add quickly that we'll try and share the other questions with our speakers following the meeting, and hope to get some responses that we can then share with all the folks on the email list for the coalition. Thank you.
Becky, thank you and the members of the panel today. Great program, and I think Wib has requested a copy of the slides so that we can post it, so that anyone can have access to the slides that we use today. So we'll hopefully get that, and as well as post answers to the questions. We have 10 minutes left, and we have a number of updates that we try to do, and also give opportunities if there are other events happening that people want to be informed about. So I'm going to ask each of the folks with an update to be as succinct as you can in giving us an update. For example, Jim Savara is going to lead off with the property tax assistance proposal. Jim, that may not be short, but do it.
Yes, thank you. And we are in the midst of the final formal consideration. As you know, hopefully the City Council had indicated that they were willing to join into a tax assistance grant if the county would provide funding and would administer the program. The county commission will be having a work session on August 3rd to get a report and evaluation of options, including the option we have proposed. Then they on the 10th, and the City Council presumably would make a decision on August 19th, so August 17th. So there are important meetings are coming up to keep you informed about the issues and how you get involved.
Jim, thanks. That was a good, quick report. Let me ask anybody who hasn't muted their phone to do so. I think we're getting some background noise. The next item is the Mobility Equity Campaign. And let me just say that John's not here, but I got a message from Mark, and they're looking for groups who want to partner with them on this the transit equity issue and health safety. So if you're interested, or your group is interested, contact John Talmadge, and easy email address, director@bikedurham.org. That's director@bikedurham.org if you're interested in working on this whole issue of the mobility equity. Next, let's go to Affordable Housing Bond Implementation Committee and Diane Katati.
Thanks, Dan. I wanted to alert people that the city clerk is currently advertising for 14 positions for the Affordable Housing Implementation Committee that will have oversight on the housing plan and the bond funding. I did drop the link in the chat, and I believe that Dr. Winders had mailed that out previously. The application deadline is August 15th. City Council will approve the members, and I expect we'll get started later this fall. I would encourage you all to share the announcement and encourage folks to apply. Thank you.
Thanks, Diane. Braggtown Development, Risa.
I will be asking the coalition to focus on the Braggtown redevelopment or Braggtown new development. They have asked us to include that in our series on equitable development, starting with this one. They are asking for affordable housing, for good paying jobs, small business spaces, and equity throughout this process. And so I would direct you to the Braggtown change.org petition, which states what they would like to see in their community. It will go to the Planning Commission for a vote on Tuesday, August 11th at 5:30 p.m. And they're encouraging people to sign the petition if you wish.
Right. Thank you. Thanks. Thanks, Ruth. Next, Northgate Mall. Marcia. Marcia?
She needs to unmute, Dan.
Sorry.
Unmute.
What's that?
All right, last time I talked to do reconnaissance and due diligence, basically finding out who's already at the table and what their interests are. We've talked to or met with neighborhood people, planning department, elected officials, and tomorrow a group of us is going to meet with the developer. We also talked to Andrew Foster.
Let me ask anybody who has to mute if you're not speaking.
Talked to Andrew Foster with one of the Duke Law Clinics, who's been working directly with the Walltown neighborhood, trying to prepare for being able to have discussions with the Northgate developers. Hopefully, we're not to the point of like screeching yet about this.
Regina, would you please mute?
Regina, thank you. Anyway, that's all. We're going along. There's one other small piece, and that is that I've got a commitment from the faculty at the NC State Department of Landscape Architecture and Planning to help run some sort of a workshop with folks in the neighborhoods that surround the mall this fall, to try to take their goals, which are all words at this point, and sort out how that might lay out on the landscape. That's all. Thanks.
Oh, I was muted. Okay, zoning amendments for affordable housing bonus and maximum unrelated household members. Dick?
Good afternoon. As most of you know, Mr. Jim Anthony put together a whole group of different proposed UDO text amendments last fall. It's been winding its way through a number of different meetings since then. The latest news is Mr. Anthony, in response to a storm of protests at the last Planning Commission hearing on this several months ago, has removed all his proposals to reduce open space and trees, which is good news. So they had 3 subcommittee meetings of the Planning Commission on this, and it's moving back to the Planning Commission, I hope in August, so it can move on from there. Another point of interest for the coalition has been, this includes a proposed change in the family definition in the ordinance to allow a greater number of unrelated individuals be permitted in a household. We very much want to see that move forward, and seems to be good support for it. But we'll see what the staff and the Planning Commission have to say on the next hearing, hopefully in August.
Okay. Thanks, Dick. The only other thing is our events coming up, and they're on your agenda that you got a copy of. And just point out, on the 28th of July, we'll have our monthly policy meeting, and contact Becky Winders. Her email address is here if you want to be added. And the Board of Commissioner meetings are listed that Jim referred to, having to do with the tax assistance program. And our next meeting will be in August, on August 17th, our regular meeting, noon to 1 o'clock. Hope you join us. Any last comments or announcements anyone would like to make? Because we're exactly at 1 o'clock. Any comments? Any announcements? If not, good meeting. I think the maximum count I saw was 72, so we had a good turnout today. Thank you to everybody involved in putting this program together, and have a good week.
Thank you, Dan.
Thank you. All right, I'm stopping recording now. Just a reminder, we're going to post this to YouTube, and it is on Facebook Live. Thank you.
Miss Regina May said she apologized for the interference, but she was on the bus.
Understandable.
Okay.
Okay. Y'all have a good one.